Good day. I'm Dr. Bill Sulkowski, and the program is Let's Talk Dentistry. And I have my special guest for this program is Dr. Sean Stopperidge. I am a general dentist in Canonsburg, and Dr. Stopperidge is an oral surgeon with a practice here in Peters Township. You know, we are, who says talking about Let's Talk Dentistry and talking about dentistry is boring? We're going to talk about some interesting stuff today on the program, and it is, the subject matter will be oral health and how it relates to the overall health of the individual and longevity medicine. And there has been, in my numbers of years in practice, an absolute direct correlation between healthy people and healthy gums and teeth. The people that are the healthiest, you know, they're coming regularly for teeth cleaning, they're flossing, they're getting their teeth repaired. So there is a direct correlation. I mean, there's a lot of parameters, a lot of factors that go into it. Some of it is nutrition, the fact that they're chewing and eating better than some. Some of it is the fact that, you know, I do believe people who, you know, brush and floss also pay attention to eating properly, nutritionally based, and drinking, you know, right quantities of good clean water, whether it's vitamin related, taking their vitamins, preventive care, diet, exercise, all those kinds of things. And the older people that come to my office and that are the healthiest also have healthy teeth and gums. So as a specialist in oral surgery and oral pathology, I wanted you, Dr. Stopperidge, to touch on the correlations between oral health and overall health, and then in the last segment of the program we'll talk about how we can prevent problems that then make life more sustainable in terms of overall health and longevity. I know early on there was always a correlation between oral health and overall health, but it almost always was that, you know, somebody with degenerate diseases such as diabetes, we were taught how to address their oral health. But now we're finding that it has a reverse and causative effect, that overall dental disease causes and exacerbates or complicates systemic diseases like diabetes, like autoimmune diseases, like Alzheimer's, diseases that are systemic that affect other areas of the body, but in fact are, for lack of a better word, precipitates or have additional causative factors that originate in the mouth, because the mouth being the beginning of the digestive tract. So with that introduction, what I'd like you to do is try to tell us, based on your reading and your expertise on the causative and symbiotic and or the relationships between systemic diseases and oral disease.
I mean, as you know, the oral cavity has a lot of bacteria, and in most cases, in healthy individuals, they maintain a balance between good bacteria and bad bacteria. So there's really never a presence of acute or active infection. Now, in some individuals who have advanced periodontal disease, the bad bacteria have kind of overtaken the oral cavity. And what they feel happens is that this bacteria can become systemic through the circulation and can cause release of other types of what we call inflammatory mediators, which are damaging to the body. There have been a lot of studies recently out there trying to link the association between oral bacteria that has become systemic and premature births, low birth weights, as well as cardiovascular disease. They haven't been able to give a direct correlation between those, but they do feel that there is some association between, again, systemic bacteria from the mouth and these conditions. The most important one that they talk about a lot is, the cardiovascular disease, and does periodontal disease and bacteria have any effect on patients having heart attacks? again, studies are out there that do show that patients who've had heart attacks definitely have a higher percentage of these bacteria within the bloodstream. But what happens is that as this bacteria gets into the bloodstream, again, it causes the release of these chemical mediators, which are responsible for damaging the tissue. And part of that damage of the tissue is inflammation within the blood vessels, which leads to a clot, which could then lead to a heart attack. That one protein, and yeah, you mentioned it before, the CRP that everybody hears about is the most common one that we are aware of. So again, what they're trying to tell patients is that oral health is very important. Maintaining, regular scheduled follow-ups in your office, maintaining good periodontal status can help possibly reduce cardiovascular disease in some individuals.
Now, you mentioned, Dr. Stoppridge, CRP, which is an acronym for cardioreactive protein, and that cardiologists are recognizing, doing blood tests to check out that, along with other, the cholesterol and the homocysteine and the different markers for heart disease, and the triglycerides, of course. But the CRP is the one, it's an inflammatory marker, and inflammatory disease is, there have ties, from what I understand, and you can correct me, but the CRP is a marker for a lot of diseases that you wouldn't think would be associated with dental, for instance, Alzheimer's, and or you talk about this. Supposedly, and they had some biopsy studies done that the heart during the coronary arteries are actually showing bacteria that are normal in the mouth that are not normal in the arteries.
Yes.
So what happens is these gums, for instance, that bleed, they may bleed micro bleeds where you don't see actually a cut oozing, but every time you're eating there's bleeding, even if you don't know it, or you're brushing or otherwise if you have gum disease. And so there's a wound, and it becomes a conduit for this bacteria that's normal in your digestive tract but not normal in your bloodstream. It's titrated into your bloodstream, causing this inflammatory reaction, because now you have this bacteria in your bloodstream and your body wants to fight this bacteria. It raises these markers, and gum disease or periodontal diseases, that they used to say cavities or dental disease is the most prevalent, and I think periodontal disease is getting to be, in adults for sure, the most prevalent disease that exists. So that is one of the issues. Also, could you tell me about, we're going to be taking a break here soon, and when we come back, I would like you to talk about the oral implications of certain things like decayed, rotted, abscessed wisdom teeth that are potential for problems. And we'll pick this up after this break. Dr. Sulkowski here with Dr. Stoppridge. Let's Talk Dentistry. We'll be back in a minute. Oh, yeah.
How far would you go to help someone? Would you go to the end of your driveway? Would you cross a street? Would you cross an ocean? Would you go if you could use your knowledge to teach someone, and in the process, maybe learn something yourself? Life is calling. How far will you go? Peace Corps.
Is how you're feeling inside keeping you from going outside? If chronic diarrhea, severe abdominal pain, or rectal bleeding are tying you to the bathroom, maybe it's serious, like Crohn's disease or ulcerative colitis. See a gastroenterologist. Early diagnosis can make treatment easier. Get on with your life. Get help. Get better. The Crohn's and Colitis Foundation of America. Dignity, hope, and one day, a cure. Contact us for a free information kit.
Sure, my neighbors Gene and Louise, they may be superheroes with superpowers, but that doesn't make them so super at saving energy and money. I mean, I like them and all, but when Gene uses that power vision to cook dinner...
Honey?
Or when Louise or Starbright tries to save a little on the lighting bill.
Mom, a little light?
I may not be able to harness the power of the elements, but I save significant cash and help the environment with appliances, electronics, and windows featuring the Energy Star label. And I improved my home energy efficiency with insulation. My thermostat? Watch this. I'm just kidding. It's programmable. I don't have to lift a finger to save on AC and heating.
Mom, Dad's making fondue again.
So discover your own energy-saving superpowers. Go to ase.org/consumers.
We're eating. Welcome back. I'm Dr. Bill Sulkowski along with Dr. Sean Stopprich. The program's Let's Talk Dentistry. I'm a general dentist. My guest today is Dr. Sean Stopprich, who is an oral surgeon and a pathologist, oral pathologist. And we've been talking about some of the correlations between gum oral health and systemic disease. In the old days, we were always taught how systemic disease and how we need to treat the patient orally with systemic disease, and it's coming back around, Dr. Stopprich, that oral disease is exacerbating, causing, and/or adding to systemic diseases such as diabetes, Alzheimer's disease, coronary artery disease, cardiovascular disease. And you were talking when we had the break about, we were talking about some of these causative relationships and cardio-reactive protein, a marker for inflammation. How do you keep that down? One of the ways, and we'll get into later, periodontally. But I'd like to talk about some of the pathology that you may encounter in your office that you need to mitigate. How do you find this stuff? In other words, gee whiz, I have a patient come in the office. We take X-rays, and we find an abscess, and they say, well, it doesn't hurt me. But you see that the bone is a big hole in the bone, and it's a potential for, and these always flare up when they're ready for going on vacation. Their face swells up, and they say, well, it doesn't hurt me. But I said, it's going to hurt you the next time you're going to take a vacation, and they might need a root canal or whatever. So what are some of the oral pathology that might exacerbate this cardioreactive protein or inflammation markers in general that may lead to systemic disease or exacerbate it? What are some of the things you see as an oral surgeon that can be mitigated, corrected, that doesn't add to this overall inflammatory process that would, in my opinion, give you more longevity, more health?
I mean, as you mentioned, you do occasionally see patients come into the office and take an X-ray. You see a large abscess on the radiograph, but clinically they're not symptomatic. They're not having any pain or swelling. Usually, we see that in association with a badly decayed tooth where bacteria has gotten into the bone and basically caused an abscess. Even though the patient's not symptomatic with pain or swelling, that needs to be treated, okay, whether the tooth needs to be removed or they have some other form of treatment to resolve that chronic infection. If not, as we've talked about, that chronic infection can become systemic and lead to the things that we had previously mentioned. Now, I don't want to say, oh, everybody who has an infection is going to develop cardiovascular disease, and they haven't come out and said that, but they have found an association between the two, but not a direct link. But in addition to these abscesses that we just talked about, we will see occasionally patients who have partially impacted wisdom teeth. As an oral surgeon, that's something that we see very, very often. And these partially impacted wisdom teeth are a perfect place to harbor bacteria. Again, even though patients may not be symptomatic with pain or swelling, just a chronic, continual accumulation of this bacteria can again lead to systemic bacteria and these release of these inflammatory mediators, which we talked about. So we try to tell patients, when they come in and we see partially impacted wisdom teeth, that they should definitely consider having these teeth removed to prevent these problems from occurring in the future. The older you are, the procedure does become a little more difficult, so we like to at least evaluate patients when they're teenagers, 16, 17, 18, and at that time do the procedure just because it's much easier for the patient, recovery is easier, the risks are less. But in addition to impacted wisdom teeth, in infections, you can see some benign cyst development around these wisdom teeth, which can become secondarily infected and again lead to the problems that we've discussed. So there are a lot of things that we see on a daily basis, okay, that are related to chronic infection or acute infections as well.
I wanted to ask you on a question that's related to this. We all know the herpes simplex 1 is the the ulcer that people oftentimes get on their lip, and sometimes that comes about when they're under stress or tired, or their immune system is compromised to a certain degree, and this bacteria that normally once you're exposed, and then this fever blister, this herpes. And I think, it's more and more prevalent. You see, you can get that by, kissing or touching lip to lip when it's and it's contagious.
Yes.
So if you're somebody in your family or somebody you know has that, you don't want to use, of course, touch that, nor do you want to really eat from the same utensils. You want to kind of wipe your mouth with the same anything, or you want to stay away because it is somewhat contagious. And there have been, if it's on the lip, it could be in the digestive tract and not just visually or in the mouth where it's sore. So, I mean, there are treatments for that, to antiviral medications that take care of that. When it comes to gum disease, now most transmission of any diseases is blood to blood or open wound to open wound. What are the controversies, or is there any? I've had this question and asked, the markers for gum disease, how contagious is it? Is it just if you're not brushing and taking care of it, or is it that bacteria that's proliferating, and if you have an open wound, your gums are not healthy, that you can actually transfer some of that bacteria?
Well, I haven't read anything in the literature that says that if one patient has periodontal disease and they're intimate with the other person, that they can then develop periodontal disease. But, as we talked about, there are lots of bacteria in the mouth, and we see in human bites, okay, that trauma, those wounds are very, very susceptible to infection just because of the amount of bacteria that's in the oral cavity. So that's where we would see that, but I can't say that there would be any direct transfer from one person to the next.
Like the herpes
yeah.
would be.
Yeah, excluding the herpes.
Yeah. Well, that question's come about a numbers of times, and and I haven't had a definitive on that. I know the herpes is very transmissible.
Yes. Yeah.
And the herpes does cause that same reaction. It causes the increased white blood cells, inflammatory response, the same way any infection would. We're finishing up this second segment. This is Let's Talk Dentistry with Dr. Sulkowski and Dr. Stoppridge. In the final segment, we're going to talk about prevention. How do we prevent the oral cavity from disintegrating or degenerating or aging? It's sort of like, you look at somebody older and you look in their mouth and you say you have a dental age of 35, how do we keep that dental age of 30 or 35 into their 90s or beyond? We don't want, we want everybody to keep their teeth their whole lives and keep them healthy. And let's see how we can do that and talk about that. Thank you. We'll be back in a minute.
Faces of suffering in Sudan, in Darfur, hundreds of thousands killed, more than 2 million people torn from their homes, exiles in their own country, forced into camps of hunger and isolation. But we have seen the strength of a mother's hands. We have seen the hope in a child's face. Catholic Relief Services is on the ground, in the camps, providing the basics of life: food, water, shelter. The need is urgent. The choice we face is simple. Watch as another chapter of tragedy is added to human history, or act now to stop the dying and keep alive the promise of a better future. Millions of Sudanese still wait for their stories to end with hope. That hope begins with you. Find out how you can help at helpcrs.org/Darfur.
Neurofibromatosis.
Neurofibromatosis, or NF, is a genetic disorder that causes tumors to grow anywhere on or in the body. It can lead to blindness, deafness, loss of limbs, brain tumors, and severe disfigurement.
Neurofibromatosis.
Let me make it easy for you. Children's Tumor Foundation. The Children's Tumor Foundation, dedicated to ending neurofibromatosis through research. Let's all start saying it.
Children's Tumor Foundation.
Would you notice if you were missing half your kidney function? According to the National Kidney Foundation, 20 million people have chronic kidney disease, and 20 million more may be at risk and not even know it. Anyone with high blood pressure, diabetes, or family history of chronic kidney disease is at risk. Early diagnosis is vitally important. To get the whole story, talk to your doctor and visit the National Kidney Foundation at kidney.org or call for a free brochure. Because when it comes to chronic kidney disease, you might not know the half of it.
Hi, Dr. Bill Sulkowski in the last segment of Let's Talk Dentistry with Dr. Sean Stopprich. I'm a general dentist. Dr. Stopprich is an oral surgeon, oral pathologist. We've talked about the ramifications of oral health and how it affects overall systemic health. And in this segment, we're going to talk about how to prevent the disease that causes this inflammatory marker that we all believe exacerbates existing medical conditions like diabetes, like pregnancy, low birth weight, like Alzheimer's and other diseases that they're finding inflammatory responses play a key role in the disintegration of a particular disease function. And what happens is as professionals, we want to practice what we've been trained to do. So we're enthusiastic about it. And when a patient comes into my office, we do a diagnostic procedure. We take x-rays, we check gum disease by probing in pockets, we find out if they're brushing, check for plaque, check their wisdom teeth, check for abscesses. And what happens is it's not like we're checking for stuff so that we could do our profession. The bottom line is what's good for the patient. And what's good for the patient is no disease. And because at the end of the day, me and mine are going to have good teeth because I'm making sure they're flossing, and I'm flossing, and I'm brushing my teeth, and I'm getting them clean regularly, and I'm getting it fixed when it's broken, and if there's an abscess, I'm getting it corrected, making sure wisdom teeth. So my whole when you go in and you've made that comment during the break that when people come to the office, when they don't come regularly, those are the ones that are having all these problems. So when they come to the office, the general dentist is diagnosing this stuff, and it's up to you to correct it. They're doing you a favor. If you went to your cardiologist and he says you have high cholesterol and it's going to lead to a heart attack, I'm going to put you on this medication. You say, thanks, doctor. When you go to the dentist and he tells you got gum disease, it's like, well, wait a minute here. It doesn't hurt. People need to be educated. That's the purpose of this program. That's one of the reasons why I take the time out and you do to come here. When somebody comes to my office and I detect, they should be thanking me. And the ones that oftentimes do because they can appreciate it. Hey, I never knew that before. Or what can I do to correct it? And that's the attitude people should have. And the ones that don't have it are only hurting themselves. If they, believe because it's not hurting and their gums always bled, or I'm going to lose my teeth anyhow, or aging, you lose your teeth, I'll wait till they fall out, save some money, or something like that. You get a lot of that over the years. They're only kidding themselves, and they're only hurting themselves because, as a profession, we're trained to do the right thing. And so the right thing in general dentistry is get your teeth clean, make sure you're flossing, correct any issues, and I don't believe in watching. Watching gum disease, you watch heart disease, watch brain disease. No, you don't watch it, you correct it. In the same instance, how does an oral surgeon, how do you approach this when people come in, when they have an abscessed tooth, you say, you need to take this out because it's infected? No, I'll wait until it kills me. How do you approach? How do you help people as an oral surgeon to get where they need to be, even if they don't understand that's where they want to be.
I mean, most of the patients that we see are there obviously they're having a problem, but there are occasionally those patients who say, well, you know, I'm not having any pain, there's no swelling, so I'm not going to worry about it. But we at least try to educate the patient and say, listen, I mean, this is something that can potentially be a problem for you and a major problem. So it's easier to treat it now than later, okay? I mean, you have to be proactive, but it all comes down to what you had mentioned. You know, prevention is really the best course of action. If you're seeing your dentist on a regular basis, you're having your routine exams, you know, some of these things can be prevented.
What's regular basis?
I mean, I guess most patients every 6 months.
Why?
Right.
Why? That seems like an awful a lot of time. You know, awful short period of time to, you know, why is that? I mean, I'm just being a little facetious here, but
well,
you know, I mean, I get my teeth cleaned every month or two because I just do. You know, I see too much disease, too much problems, and I sit there and you know, and it feels good to have that, you know, to really on a regular basis. You know, when people wait too long, it's a big job. When it's a short period of time, it's, you know, a little bit here, a little bit there, and it stops you know, the progress of this gum disease, which is so very, very important to do that. But the 6 months, I was being facetious. It's you know, that
insurance driven.
Yeah, that's probably what it is. But at the same time, that's what people who are healthy do. Sometimes I have numbers of people every 3 or 4 months.
Yeah, I think there are some people who have advanced periodontal disease, need a little more close follow-up, and then they're seen every 3 to 4 months.
Yeah.
But again, prevention, and you know, when we see patients in the office with, you know, impacted wisdom teeth, and we notice that there are some periodontal pockets back in the area, which is very common, we definitely suggest that they have them removed. I mean, there's no question. There's a study that was recently done through our national society trying to link periodontal disease associated with impacted wisdom teeth and pregnancy complications. No direct correlation, but there is some association between periodontal disease with impacted wisdom teeth, low birth weight, premature deliveries. So, you know, we try to educate patients to make them aware that these things do exist, and have them seek general care from their dentist on a regular basis, as you mentioned. If there is a problem, get it taken care of before it becomes symptomatic.
Thank you, Dr. Stoppridge. This segment of Let's Talk Dentistry, we talked about oral pathology and how it affects systemic disease and vice versa. And if you have any questions, you can contact Dr. Stoppridge at 724-941.
942-4800.
942-4800, and I can be reached at 724-745-0103. The message for the day is don't brush and floss all your teeth, just the ones you want to keep. Thank you.